news. There are over 70 people who've died in Goa because of shortage of medical oxygen. Once again, this is over 4 consecutive nights. The question that I want to ask you is, this surge in demand for medical oxygen, is it linked to the new variant, Dr. Guleria?
So there is a surge in demand for oxygen based on the number of cases that we're seeing. The variant has caused this surge in the cases to occur at a very short interval. If you look at the current curve, you'll see that it's almost vertical. That means in a very short duration of time, the number of cases has increased so much, and therefore hospitals have not had time to have a turnover. If this curve had risen to even 4 lakhs slowly, you would have a time for turnover. That means those who got admitted on day 1 could get discharged on day 7 or day 10, and then newer patients could be taken in. But if the curve is almost vertical, then you don't have that luxury, and that is creating this huge demand for oxygen. The second issue that I'd like to really say is that we must also understand that this pandemic is moving. It is moving from one area of our country to the other area. It seems to be moving now towards the east and the southern part of the country, and therefore our oxygen movement should also follow the pandemic. So in areas where now the cases have come down and they are comfortable, their oxygen demand their supply should actually come down in that manner, and it should be given to those areas where there's an increasing demand, so that as a nation we're able to really provide oxygen in a more holistic manner.
Interesting that you say that the pandemic is actually moving towards the east and the south. Why do you say that?
Because if you start looking at what's happening in states like Tamil Nadu or southern states, or if you start looking at data from the northeast or from Bengal, you start seeing that as compared to what is being reported in Delhi, that the cases have now started coming down, there is a rising trend in those areas. And the other concern, of course, is the movement of the pandemic from urban area to the rural area.
Yes. Okay, so these are, of course, states now that emerge as cause of concern. But, coming back to the variant, the B1617 variant, which now, according to the World Health Organization, is also emerging as a variant of concern. The big question, Dr. Guleria, is will vaccines work? Many experts say that there will be a diminished efficacy. Do you agree?
Yes, so it's likely that there may be some degrees of diminished efficacy as far as the vaccines are concerned. There was a lot of concern with the AstraZeneca vaccine and the South African variant in some data which was published some time back. But we must also remember that, for most vaccines that we have a good amount of buffer. As a matter of fact, the WHO says that if your vaccine efficacy is 50%, then that is acceptable. Most vaccines that we have currently have an efficacy which is up to 70 to 90%. So even if we look at a vaccine efficacy which comes down, let's say from 80% to 60 or 70%, it will still be effective. And the efficacy that we're currently looking at is preventing severe disease, preventing deaths, and to some extent preventing people from getting the infection.
So I
think it will work. It will still be effective, but may have a reduced efficacy, and that is why over a period of time we will need to look at whether we need to tweak the vaccine to some extent.